later on, I get that. But so far we've been talking about sending COVID-positive patients coming from hospital. Right?
No.
That's what the discussion is about.
No, that's not true. We're talking about sending people from hospital, and they were sent to be...
But some were COVID-positive and they were not tested.
And so they were all isolated. They were all treated as if they might have the disease.
Mm-hmm.
So, and actually...
Although care home providers describe the isolation plan as laughable.
I will, and I'll give you this other, case in this argument, which is that the increase in infections that we saw in care homes happened later than after, significantly after, the point at which there were these discharges. So the fact... the point is important, Dan, because...
Yes, but it is important
because actually what we have to do is learn the right lessons. So what I'm planning to do...
And that's what I'm trying to do, because the Department of Health also sent out guidance during the first wave saying COVID-positive residents with symptoms, so this is with symptoms, we're not even talking about asymptomatic people here, could be admitted from a home setting into a care home. Why did you think that was safe?
Because you have to work out, based on the clinical advice, what is the most likely thing to protect lives.
From Italy and you knew from China that the mortality rates in elderly people was incredibly high.
It's incredibly simplistic to make this argument. You have to look at your likelihood...
What's simplistic about it?
Well, I'm about to explain. Your likelihood, for instance, of... there are people who need to go in to get care because their risk of mortality if they stay at home is high. You have to take that into account as well. So we've got to look at all of the different points, and that's what we did look at the time.
You told Andrew Marr last June you didn't put a protective ring around care homes during the first wave of the pandemic. Have a look.
That phrase, protective ring, do you at least regret that?
Well,
it wasn't true, was it?
I said that much later about what we were doing for the winter plan, and it's been interpreted.
Do you stand by what you told Andrew Marr?
I used that phrase later, yeah, to describe the work that we did to learn the lessons from the first phase, the first wave, which meant that actually, in terms of protecting...
But I've looked into that. And it's just not true, Mr. Hancock, because you actually used the phrase multiple times at the start of the pandemic, well before the winter plan. Look.
Right from the start, it's been clear that this horrible virus affects older people most. So right from the start, we've tried to throw a protective ring around our care homes. Well, we absolutely did throw a protective ring around social care, not least with the £3.2 billion worth of funding we put in right at the start, topped up with £600 million worth of funding on Friday. Further to that, the Honourable Lady, I think, does know that testing has been carried out in care homes throughout. And I'm glad we've been able to protect the majority of homes. And we'll keep working to strengthen the protective ring that we've cast around all our care homes.
So when you were telling the truth, then or to Andrew Marr?
Both. Because
how can they both be true?
Because you've just played those clips from May, and your criticism about the discharge
before the winter
was March, right? So,
but you're talking about it's in May. You're talking about what you did in May and April.
There's two ways of describing.
So you're not talking about what you did in May. You're talking about what you did in March and April.
There's two ways of answering this. The first is that the issue you were raising about people having to move out of hospital in order to be able to save lives in hospitals, right? That was in March 2020. Later, I used this phrase, throwing a protective ring, in May. So it's absolutely true, the chronology. But there's a second point, which is much more important, which is we've got to step back from this, right? We've got to step back from looking at each... picking out individual points. We've got to ask the question, how do we make sure we're better prepared next time?
No, I get that. I get that. But I want to talk about some of the individual points because then we paint a picture.
No, you've gone into specific and individual points. But there's a reason I want to say this. There's a reason I want to say this because I think it's very important that especially given the role that I had, that I both answer these questions, but also set out the whole piece.
Of course.
So I'm writing a book about the the experience, what it looked like from being Health Secretary, what actually happened at the time.